I'm Dinky Levitt from the University of Cape Town and the Chronic Disease Initiative in Africa. Chronic diseases affecting South Africa and indeed the African continent in ever-increasing numbers. In a continent where the major diseases are tuberculosis, malaria and HIV, chronic diseases has been the poor relative for too many years. But governments are beginning to recognize, I believe, that chronic diseases are increasing, but it is an ongoing battle to get the ear of government. The research we plan to do in our center is to look at a model of care that takes care from the community to the primary healthcare facility and back again, and incorporates all aspects from community health workers right through to the facility, the development of tools to screen for chronic diseases, preventative tools for prevention of chronic diseases, as well as tools for the management of chronic diseases. Furthermore, we're particularly interested in how we communicate with people with chronic diseases and people at risk for chronic diseases. The traditional way of communication, the talking down, the patronization that is so common in the interaction between healthcare workers and people that we see is not optimal for changing behavior. So we're interested in looking at how we can change people's behavior in terms of the interaction between healthcare workers and the community. Our research will help people in a number of ways. In the first instance, we would hope to identify people with risk factors for chronic disease much earlier, and thus have them access healthcare much earlier. Our research will also help to improve the care for people with chronic diseases. We would also hope to develop economic models which can cost or enable governments to cost various interventions so that governments better understand what they are acquiring for a particular intervention or effort. The training we're doing needs a great deal more work. It is in its infancy. We are trying to identify students to work with us, as well as departments of public health in universities to improve the training in chronic diseases, epidemiology, and health systems approaches. The long-term hope for our center is that there will be fewer people on the African continent who experience both directly themselves as well as through people in their family and in their communities reduce the impact that chronic diseases have on them and their lives. The suffering that people experience through chronic diseases is immense, and we would like in some way to lower this, lessen this in the region.